So today I'm glad to be in New Delhi, India. It's a little bit far from home in New York, but I'm glad to be working and visiting with my friend and colleague, Dr. Garima Srivastav. She is the head of the Indian Association of Cosmetic Gynecology. And we're going to be talking about a real problem that actually affects in America 19 million women. Worldwide, it affects 200 million women, which is SUI. Do you know that in America, the average woman who have SUI spend about $900 to $1,000 on adult diapers every year?
That's
actually, yeah, it's more. Americans will buy more adult diapers than baby diapers.
Oh.
What about the numbers in India?
In India too, because we are a huge population and a lot of women do spend their time post-menopausal, and plus the number of deliveries are more. So there is a rough statistics that say that around 30% of Indian women do encounter incontinence at some part of their life.
You know, that's a huge problem, because guess what? A lot of women, even very few men, because SUI or stress urinary incontinence happen in 4 women to 1 man. So men still have it, but women in particular fail to tell the doctors. Sometimes they just try to deal with the issue on their own, don't tell the doctor anything about it. But this gives 54% of these women lack of confidence, lack of self-esteem. Not only that, but about 45% of women will have a negative impact on their intimate relationship with their partners. So I think this is an issue that we can address with new techniques and new methods that we have in functional or cosmetic gynecology, right?
Yes, very true. And traditionally, we have been advising Kegels exercises to these women, as we all know. And how to do Kegels, there has been so much written and talked about it. How many times should it be done? So just to tell you, Kegels is basically contraction of pelvic floor muscles. And you have to contract those muscles for 3 seconds, release it for 3 seconds, and minimally they have to be repeated 10 times in a single go. And it has to be done 3 times a day.
Yeah.
How many people actually do it?
Not only that, but remember, SUI affect elderly women and menopausal women, and we all know that the asthenia or the muscle weakness in older age contribute negatively to the ability to do these Kegels. It's very hard. So we have good news for a lot of people. One of the companies that is really leader in the field of cosmetic gynecology with so many of their products have this new device. It's relatively new that uses the focused high-intensity electromagnetic waves, what we call the Emsella chair. So simply, you're fully clothed, a woman or a man, and you sit on the chair, and the chair will do the work for you, right?
You simply have to sit on the chair. How wonderful is that?
Yeah. How long do you sit on the chair?
28 minutes.
And how many Kegels do you get?
12,000 supra-maximal Kegels.
Wow, 12,000. Imagine 12,000 Kegels. Actually, it's 11,800, but let's say around 12,000. That happens in 28 minutes. Does the work for you? It works for both women for SUI. It works as well for men, because the contraction of the pelvic muscles can help a lot with things like erectile dysfunction as well. It's such a blessing to have such a technology, and we're looking forward to more technologies to help the patients cope with their problems that they thought before no solution could help. But I encourage people to look into that, and that can be a great choice for many patients suffering from stress urinary incontinence all over the world, out of these 200 million women, right?
It's very true.
And I'm looking forward to meet you again very soon with another tool that help the patients have a better life. Thank you very much.